All right, everyone, we are back with the 2018 CDH Telethon. It is 12:18, and we are into a 15-hour live telethon going to 11 o'clock Eastern Standard Time. And I am joined today by Dr. Matt Harting and his wonderful nurse, Ashley, who helps run the CDH clinic down there in Houston. How are you both doing today?
We're doing great, Dawn. Thank you. Thanks for having us.
Wonderful. Thank you for being here. Excited to have you on board. So I am going to let both of you talk about what you're doing down there in Houston in your CDH clinic with the hospital and also with the study group. So I'm just gonna let you have the floor.
Sure. Again, I'm Matt Harting. I'm a pediatric surgeon, and Ashley Ebanks is a nurse practitioner who runs our long-term follow-up clinic specifically dedicated to kids with CDH. And, we've been interested and focused on CDH for now almost 30 years. And it really started with Kevin Lally, who's the head of our department and a long-time advocate for CDH. And then his wife, and he's a pediatric surgeon, and his wife, Pam Lally, who's a pediatrician and who runs the congenital diaphragmatic hernia study group and the registry that's associated with that group of institutions who all collaborate, over 70 institutions who collaborate together to try to understand more about CDH. I'll talk a little bit about our center, but I really want to focus on, I think, the work that a number of people are doing. We're here in Houston at the University of Texas and at Children's Memorial Hermann Hospital. And so we have a program that we have tried to create specifically centered around CDH, but that we truly feel is comprehensive, that works on things from basic and translational science research. In other words, we're trying to understand really the basics of the way that the blood vessels in the lungs work or don't work for kids with CDH. We're trying to understand how we take the things we learn at a really basic level and how we can start to figure out how to apply those to kids so that we can help kids and families. We do a lot of clinical research, and I'll talk about the study group in a little bit, a lot of clinical research, centered around how we can understand what we're doing, how we can do it better, and how we can help a myriad of institutions work together so that every kid with CDH gets the best shot that they can, not just to survive, but to thrive and to survive well. And then from fetal center through delivery, through neonatal care, ECMO, surgery, ongoing hospital care, and then on through long-term follow-up, we have a clinical program that really tries to not just address what kids need at every stage and what families need at every stage, but is trying to advance the research and trying to push the bounds of both what we know and what we should be doing to care for these kids. And so that's just a little bit about our center, and that's the Comprehensive Center for CDH Care. But I think what's really neat, and I think what you've been involved in, what a number of centers around the country and around the world really are involved in, are in trying to work together to change the lives of kids and families with CDH. And I think the CDH study group is a really special example of that. For anyone that is not aware, the CDH study group is a collaborative of now more than 70 institutions that collects data on the hospital course, the initial hospital course of kids with CDH. And Kevin and Pam Lally, who I mentioned before, are really the originators, are really the leaders, and have taken enormous steps to try to bring institutions together. But it's all the individual institutions that make a difference here, and it's all the CDH coordinators and the nurses and the physicians who take the time at every institution to submit the data from all of the patients they have born with CDH to this collective group. And then we all get together and we ask questions to try to understand what kids with CDH both are going through, how our therapies are working, what we can do better, and how we can start to and continue to change the care that's provided for kids with CDH. And again, I think that kudos to all of the centers that are part of the CDH study group and to the efforts that they make and to people that are a part of it. And kudos to the families who, who seek out those centers and who are willing to, to have their kids be a part of such a group to try to advance the help, for kids for the future. So I think that's a little bit about what we're interested in. I'm going to let Ashley just talk a little bit about the long-term follow-up clinic or the dedicated clinic, because I think that's been something that over the last few years has been a really important addition, not just to our center, but fortunately there are a few centers around the country who are working in this direction. I think it's really important for the survivors and for the families of kids with CDH. So Ashley?
Yeah, so we have a multidisciplinary clinic. We have a few different doctors and groups that are involved. We have pediatric surgery, we have pulmonology, we have a dietitian, which we found to be extremely helpful in these kiddos. We have a pediatrician on board, we have GI, cardiology, pretty much anybody we need to take care of these kids with CDH we have involved in our clinic. So we meet once a month, and depending on the severity of the child, depending on the severity of the defect, we kind of have a set protocol on how we see them. So usually the first year of life, we see them kind of fairly often. The first few months of life, we see them pretty much every month. And then after that, we kind of spread things out as we feel like they're doing well, they're improving, they're gaining weight, we check for recurrence, all of those kind of things that we know or have long-term consequences for these kids. So it's something that I think we're both very passionate about. All of the people involved in our clinic are very passionate about CDH and making sure that we do what we can for these kids long-term and try and prevent things if possible.
Dawn, one of the stories that I like to share is for anybody that's been around the CDH research world, they've heard the name Jay Wilson. He shows a slide. He's a pediatric surgeon that was at Boston and now has joined our center. And he used to show a slide of a family dealing with CDH. And the slide had a month's worth of clinic visits for a specific family. And it was, 8 different doctors, 15 different visits on 15 different days. And when you think about travel time, you think about what these families are going through, that just seemed absolutely ridiculous. I think another sort of impetus for the clinic is when I heard from a number of families, they would say, gosh, my child is sick. And they have 4 different doctors. Well, which one do they call? Well, they're not sure. They're not experts. They don't have any idea of what physician to reach out to. We wanted to give these families one number and an easy, straightforward way to access help. And again, there are a lot of, or at least a number of centers around the country trying to do this, but for us, that seemed like an easy and straightforward solution, the right way to try to handle follow-up for this complex disease. So.
Yeah, what Jay did was phenomenal, definitely pioneering for our kids and also pioneering for other medical issues as well with the clinic that he started. And it's being duplicated, but not enough for our taste. We'd like to see a lot more hospitals doing the same, because the problems that you just described for families, it's ridiculous. And the exposures to viruses that our kids have every time they're in a waiting room, and plus the cost and time on families for multiple doctor visits, everything you described, exactly the world many of our families still live in. And hopefully we can push more CDH centers in the hospitals that specialize in CDH so that the families don't have to go through that. I was in Houston last year at your CDH reunion, and you have another one coming up in this week, next week. When is it?
Yeah, it's next weekend, the 29th.
The 29th. 28th.
Yeah.
And your shirts look great, Ashley. I love the shirts this year. They look wonderful.
We worked really hard on them.
They look good. I had a great time last year meeting so many families, and it is obvious how much the families love both of you, love the center, love the work that you're doing, and feel comfortable talking to you and coming to you with their concerns. And even the grieving families, you could just see the admiration in their eyes for you for how well you took care of their children. So, and we adore you here. And we love working with you on the medical advisory board and with the study group and the research that we're going to be accomplishing together. And it's just an honor to know both of you, to work with both of you. And we're really excited to see what the future holds for CDH. It seems to be a CDH renaissance happening in the medical world right now. So it's a good time to be a part of that and to push finally for better care for the kids. So thank you for what you're doing.
For sure, Dawn. Well, thank you, and thanks for having us. But more than that, thanks for what you do and what you have been doing, and your organization, your entire team. You know, this is a team effort, and CDH is not something that any individual, any institution, any one organization, any one individual, or any one family is going to tackle. It's a team sport, and we certainly believe that. Whether that's research side, whether that's support side, every family's journey is a little bit different, and I'm appreciative. I know the families are appreciative of what you guys are doing, what you offer, and just it's a positive opportunity for everybody in this community to join together. So thanks for having us, and thank you for what you do.
Absolutely agree with everything you said. We're not going to unless we do it on one wide front, all of us on board, and we're getting there. And it's an exciting time to see that happening. So thank you, Matt. Thank you, Ashley. I will talk to you soon. I hope you have a wonderful day, and thank you again for all you do.
Thanks again for having us, Dawn.
Thank you.
Bye-bye.
Absolutely. Bye-bye.
CDH is a birth defect that affects thousands of kids every year. We are trying to raise awareness today.